Hi everyone, welcome to my channel. Today's topic is for BSc third year, which is from Pediatric Nursing, Growth and Development in Children. In this video, we will learn about what is growth and development, what are principles of growth and development, factors affecting growth of development, and our topic will go on continue in the next video. Let's get started. This is a simple diagram which symbolizes growth and development from a newborn, neonate to infant, and then children, the toddler, preschooler, schooler, adolescent, adult, young adult, and then older adult. As we are concerned only about children in pediatric nursing, we will be learning about various stages, growth and development of children. That means from newborn till adolescent. Growth is increase in physical size of the body or physical characteristics of the body. That's why it can be measured. We can measure growth in kg, meter, inches. Whereas development is progressive increase in skill and capacity of function. Growth is a qualitative change, which is different from quantitative change. Quantitative change like growth could always be measured, while qualitative changes, that is development, cannot be measured. But we can still measure it by observing the behavior of the child. We cannot measure it like growth in kg, meter, inches, but yes, we can almost measure it by observing the behavior. There are principles of growth and development after that. First principle, very important, is a cephalocaudal. That means head to toe. Direction of growth and development starts from head and then other organs follow till the toe. Next is proximo-distal. This is a directional sequence. That means growth starts from proximal and extends towards distal. Proximal is close to the center, distal is away from the center. Proximal part of our body can be considered as heart, where distal part of the body can be considered as extremities. Here we have example of spinal cord. Spinal cord is a central part, that is proximal part. It develops before outer parts of the body, outer parts of the back or outer parts of the whole body. Next principle, growth and development is a continuous process. That means it continues throughout the life, growth and development. After a certain year, growth stops. That is, increase in height, increase in weight. Weight can be variable, but certainly increase in height stops. But development is still continuous. So growth and development overall is a continuous process. Next is orderly or sequential process. Growth and development is orderly and sequential because a child acquires one quality before acquiring another complex quality, one simple quality that child acquires before acquiring complex quality. Infant stands before they can walk. First of all, they hardly stand by holding a furniture, and then they learn to walk by holding the furniture, and finally they learn how to walk independently. That is a orderly or sequential process. Growth and development is influenced by environmental and genetic factors. So rate of growth and development can be different because it is influenced by environment around us and the gene that we carry. Growth and development is predictable. You can make prediction that a child can stand at the age of 9 to 12 months, stand with the help of furniture, and then with the help of nothing. Child can stand independently after that. So growth and development can be predictable. You can predict that at this age, child can get toilet training. At this age, child can hold a scissor and use a scissor. At this age, child can run, child can jump. Development proceeds from simple to complex. That means development, the child learns or the child develops from simple activities to the complex activities. First of all, the child holds anything, infant holds anything by using two hands, both hands. And then slowly infant learns how to hold the things in one hand. And finally, the infant learns how to hold the thing between fingers. Next is certain stage of growth and development are more critical. That means there are certain stages in which we need to pay more attention, like prenatal phase. Prenatal is before delivery, that is pregnancy phase. During pregnancy phase, if the mother is healthy, if the iron level, calcium level, overall body physiology is healthy, then it is certain that she will give birth to a healthy baby. Growth is uneven between individual. Growth rate of one child might be different from growth rate of another child. Height increase, weight increase. Also, recovery from disease differs from one child to another child. There is coordination between increase in size and maturation. That means along with increase in size, changes in brain and nervous system also also is responsible for maturation. It helps the children to improve their thinking skills and motor skills. That means in order to run the whole body, body and mind needs to be coordinated. Both the body and mind needs to contribute. Principle of individual differences. Individually, the child can be different from one another, especially the two genders, male and female, can be different because they can have a different growth rate to one another. Also, growth and development proceeds from general to specific. That means the growth, and first of all, growth is general and then growth goes to specific. Example is, first of all, an infant, a 7 to 8 month old infant, looks at an object, whatever he or she wants. They focus at the object at that age. When the 8th month ends, then the infant is ready to try to reach out for the object. That means they are proceeding from general to specific. First of all, they are focusing at the object and asking for it. After a few months, they are reaching out for that object by moving themselves. So, general to specific. Next topic is factors influencing growth and development. There are many factors that influences growth and development and each have their own importance. Okay, they are first of all genetic factors. We all carry different kind of genes according to our location, according to our family, according to our ancestors. Such genetic factors makes up our whole body physiology and body psychology. How much, no matter how much we try to change our physiology and psychology, there are some factors that we cannot change. Some modifiable factors can be changed, some lifestyle factors can be changed, but there are some factors like immunity of our body, like tolerance of our body that we cannot change because that is something that we have got from gene. So genetic factors affect growth and development because some child have genetically up and gene. They grow and develop on time, while some children grow and develop little bit later. Next is sex. Sex or gender also determines the rate of growth and development. The body, here it is given that the body functions differently at same age and signs of illness also may vary. That means signs of illness also may be different. Between male and female, same disease might show different kind of features. Next is race and nationality. Our gene depends upon what race we belong to. We carry traits, designs of DNA of that race, and that is how our body is made up of. So we are genetically or racially susceptible to something, or we are racially insusceptible to something. That is about race and nationality. Prenatal factors. This is factors related to pregnancy. This is maternal nutrition, maternal infection, maternal substance abuse, illness of the mother, and hormone level of the mother. That means during pregnancy, she has lack of nutrition, if she suffered from some infection, if she has done substance abuse, or she already has some kind of illness, systemic illness, hormonal illness, then that can hamper or that can influence, let's say, health of the born baby. Postnatal is after delivery, after the child is born, growth potential of that child, ability to grow, nutrition, breastfeeding. For first 6 months, the nutrition is only exclusively breastfeeding. Childhood illness, if the child suffered from any illness, physical environment, psychological environment for mother and baby both, cultural influence, and birth order of the child. What is the order? Is the baby first baby of the house, second baby, third baby, or what is the birth order of the child? These all factors influences the rate of growth and development. Here are some differences between growth and development in a very simple language. You can revise by using this table. It includes details about cell division, about time, about measurement, about individual differences, and about experiences, how learning and experiences influence our growth and development. After that, there are some theories which are always used, always, till the time we study growth and development, that these stages are always used to describe the characteristics. Like this is Sigmund Freud's psychosexual stages. In this we have oral, anal, phallic, latency, and genital stage. We have age ranges for each stage and characteristics of each stage while learning about 0 to 1 year old infant, 2 to 3 year old toddler, and likewise we need all these characteristics and a name of this stage. So it is important that you all remember about this Sigmund Freud's psychosexual stages. There are other stages, other scientists too. There is Erik Erikson's stages. There are 8 stages actually, but we need only up to 5. That is identity versus role confusion, because we are learning about children specifically. So identity versus role confusion is the psychosocial task for adolescent. So we need only up to 5, identity versus role confusion, and there is characteristics about this stage in the right side. So you all need to remember this and what happens here. Okay, trust versus mistrust is for infancy, autonomy versus shame and doubt is for toddler, initiative versus guilt is for preschooler, industry versus inferiority is for schooler, and identity versus confusion is for adolescent. We have Jean Piaget's stages of cognitive development, very, very important. Here there are 4 stages: sensory motor, pre-operational, concrete operational, and formal operational. They have sub-stages too, which will be detailed in the infant stage and toddler stage. There are age ranges 0 to 2, 2 to 7, and likewise, and characteristics. You need to remember this also. Because we have till adolescent 11 years and older, so this whole table needs to be learned. There is a theory of moral development too, that is Kohlberg's theory of moral development, which has numerous steps and 3 levels: pre-conventional, conventional, and post-conventional level. There are 1, 2, 3, 4, 5, and 6 steps, and each step has characteristics about morality of growing children. So you need to remember theory of moral development as well. Thank you so much. Next video will be about infant's growth and development.